Welcome back, everybody. Well, a fascinating study making news right now. Even before they can walk and talk, babies like to see those who do wrong actually punished, and they actually have sympathy for victims of bullies. Now, that's according to new research out by the University of Missouri. Here, part of that study is right on your screen. The top half shows what the infant is seeing, and the bottom half, the child's reaction. The PhD candidate leading the study, You-Jung Choi, and Associate Professor Dr. Yuyan, Associate Professor, are joining us now. Welcome, ladies. Great to have you here today.
It's a pleasure to be here. Thank you.
Thank you.
This is very interesting because it actually shows that these babies have the emotions and are actually socially savvy even before they can walk and talk. Dr. Liu, can you tell us more about this study?
Yes, of course. Our study shows that even at 13 months, babies can use their understanding about others' perspectives and their social evaluation skills to understand complicated social situations. And I'll let You-Jung jump in to tell you a little bit more about the procedure.
Okay, so the parents generously volunteered to bring their babies to the lab, the infant cognition lab at the University of Missouri. And then the babies sat on parents' lap, and we performed a puppy show for them. And the babies cannot talk, so we measure their looking times to gauge their understanding.
So how did you actually determine that they are aware of someone actually doing wrong and actually having sympathy for a person who might be a victim of a bully? If the puppets really provided that information to you?
So actually I told you before, we measure baby's looking time. So it's about like an expectation thing. So things that are common or expected are boring, and babies quickly look away. But things are unexpected or unusual, however, that are really interesting, and babies tend to look longer. So we measure their looking time to compare these two events and see whether they can understand and they have some expectations about these events.
What can you tell in terms of the differences in the way they look? Doctor?
We measure how long they look. So if things that are unexpected, they spend longer time looking at it. And in our puppet show, in the first part, what we showed is there were two puppets who interacted positively. And in the second part, we introduced a third puppet who got hit by one of the first two. And in the third part, we looked at how these, in the second part, we created different scenarios. In the third part, we looked at how these different scenarios would change the interactions between the two puppets.
All right, let me ask you, ladies, let me ask both of you, though, in terms of the overall findings, what do we come away with from your study, and what was the most surprising aspect to the study as you monitored these infants? Doctor?
Our study shows that babies can understand complicated social situations, and I wouldn't want to use the terms such as victim or bullies, because in our study one element was we showed a singular event in which one puppet hit another, and bullying to us is a persistent behavioral pattern, so that's why I don't think our study is about bullying, but hopefully future research can tell us more about it. And so our study shows that babies can keep track of who knows what about whom to make sense of social interactions that are happening around them.
Well, it's very interesting, ladies. Thank you so much for joining us. Appreciate it.